everyone, I'm Dr. Renee and welcome to my channel. In last week's video, I talked about complications of the bone marrow transplant, but I decided to cover some of the complications in a separate video. So today I will be talking about other potential complications from a transplant. Other potential complications include graft rejection, graft versus host disease, as well as infertility. Of course, this is not an exhaustive list, but just I thought that it would be important to cover some of the more common complications that people are most concerned about. So these are complicated topics, and so in this video I try to stick to the basics for each one to make it a little easier to digest. So I will start by talking about graft rejection. So what exactly is graft rejection? Graft rejection occurs when the functioning immune cells in the recipient's body recognizes the donor cells as foreign, and it essentially attacks the donor cells. So there are three types of graft rejection, and they are hyperacute rejection, acute rejection, and chronic rejection. When hyperacute rejection happens, it usually occurs within minutes to hours after the transplant. And this is commonly seen when a recipient is given the wrong type of blood. In more recent times, this form of rejection is not one that is commonly seen, but can certainly happen. The next type is acute rejection. This can occur from 1 week to 3 months post-transplant. And it is believed that this happens in all recipients on some level. And this is why transplant patients receive very strong medications to prevent and control graft rejection. Landon also received pretty strong medications, like I mentioned in my previous video, to prevent graft rejection. And in Landon's case, about 3 weeks post-transplant, he developed a full body rash, and there was concern that this could be due to either graft rejection, graft versus host disease, or possibly even an infectious process. So the doctors evaluated Landon with many tests, and thank God graft rejection was ruled out as the reason for his rash. He did receive strong medications, like I mentioned, including medications that would treat the possibility of graft versus host disease, which I will talk about a little bit more about later on in the video. The next form of rejection is called chronic rejection, and this can occur over a period of years. This happens when the recipient has a persistent response against the donor cells or an organ, and it slowly damages the donor cells, or it can be the donor tissue that is being damaged, or an organ that is being damaged. With chronic rejection, it's also important to keep in mind that this form of rejection can occur over a period of months to years, and this can be something that someone has to permanently live with. So what are some signs and symptoms of rejection? In the case of graft rejection, people may develop flu-like symptoms, including chills, body aches, headaches, shortness of breath. Some people might complain of a cough or nausea. A lot of people will have a lot of gastrointestinal symptoms. So they might experience a lot of bloating, discomfort, as well as other type of GI, what we call GI symptoms, or gastrointestinal symptoms. Some people also develop fluid retention and weight gain, which is usually an indication that there's a change in the kidney function. So it's a very complex process when we're thinking about graft rejection and how that is going to be managed. So that is the basic summary of what graft rejection is. Now I'm going to move on to talking a little bit about graft versus host disease. So graft versus host disease occurs when the donor bone marrow or stem cells attack the recipient because it sees that recipient's body as a threat. And so, for example, with Landon, as I mentioned, he developed a rash after his bone marrow transplant. And the doctors were concerned about graft rejection as well as graft versus host disease. And with graft versus host disease, this can occur at any time after a transplant. But in general, it is more commonly seen after the recipient's marrow starts to make healthy cells. Any tissue or organ can be affected, and the symptoms usually vary. But common symptoms of graft versus host disease, as I mentioned, would be rash, mouth ulcers, and some people might complain of abdominal pain as well as other gastrointestinal symptoms. Landon was also on pretty strong medications to prevent graft versus host disease. And as I mentioned before, his rash eventually went away, and the abnormal liver test that the doctors were monitoring eventually also improved. Of course, one of the risks of bone marrow transplant, as I mentioned, was life-threatening infections. And so while Landon was being treated for his rash and for possible graft versus host disease, this was something that the doctors kept in mind, and also they kept him on other medications to try to prevent infection. Now that I've talked about graft rejection and graft versus host disease, I will talk a little bit about fertility preservation. So this is a big concern for many people who are thinking about a transplant, either for themselves or a loved one. In our case, Landon is of course a child and nowhere near childbearing age, but we wanted to give him the best chance of preserving his fertility. There are current and ongoing studies for boys who are starting chemotherapy, which I mentioned in my last video. The reason for this is because, as I mentioned, chemotherapy is toxic and can lead to infertility, and of course can affect someone's ability to have children in the future. So we consented to Landon's participation in a testicular preservation study. The more information scientists gather, the better options people will have to preserve their fertility in the future. And so the next question is, what is testicular preservation and how does it work? Testicular preservation is when a small piece of testicular tissue is removed prior to chemotherapy. And that tissue is frozen and can be stored for many years until it is needed. The point of doing this is obviously to have testicular tissue that has not been exposed to chemotherapy. And this tissue can then be used later in life to make sperm. This of course would involve reimplantation of the tissue. And in Landon's case, we are looking at many years before we will know the answers to this, and of course whether or not this is something that he will need. But we thought that it was important to take advantage of this opportunity and see what happens in the future. So that is all I have for today. If you like this video, please press the like button and subscribe to my channel. And I also have a couple of resource links for anyone who is interested in learning more about sickle cell, or if you would like to donate to a sickle cell organization. Thanks for watching, and I will see you next time.